Assalamu alaikum rahmatullah. As many countries across the world ease strict lockdown measures, many of us have already or will be returning to work and school. But this will be a different world. In today's programme, we'll be looking at the new normal. What kind of changes can we expect and how can we prepare best? As usual, we'll have a number of guests on our programme to help discuss these matters. Please do send us your comments to us at live@mta.tv and join us on Instagram and Twitter. But let's first take a look at the changes in lockdown that are taking place.
A return to how life was at the start of 2020 is some way off. Even when lockdown restrictions are eased, coronavirus will affect our lives in many ways. It's time we start accepting the new normal that is awaiting us as lockdowns come to an end around the world. With more than a month of video conferencing, many companies that thought it wasn't possible to work from home will have to accept an end of hot desking. Seating plans will need to be re-evaluated with social distancing in mind, and mandatory temperature checks could be held as you come into work, which would mean smaller companies may shift most of their workforce to work from home. That is also what governments are urging, along with staggered shift times to reduce rush hour crowds. For the retail sector, there will be an immediate sales bounce after end of lockdown, and stores are likely to lower prices to shift stock. But it may be short-lived if people have been made redundant and are unable to spend. Larger businesses in good financial health will be able to give customers what they want, but smaller firms may simply run out of cash and close doors permanently. It is possible that rush hour on public transport may not be seen for a considerable amount of time. With proposed staggered work times to minimize crowds and most people working from home, the transport industry will certainly take a hit. Social distancing while traveling at the moment is possible due to the fewer number of travelers, but as some industry leaders have commented, it is physically impossible in the long run. Some airlines might not survive this crisis. Others could perish in the aftermath, with Virgin Airlines already cutting 3,000 jobs. Initially, there may also be nervousness about flying in the wake of a global pandemic. Thermal imaging cameras which check your temperature as you walk through could become commonplace at airports. A smaller aviation market means ticket prices could rise. More than 90% of the planet's children are out of classes, according to UNESCO. The disruption will ripple for years. Teaching has moved online, with digital lessons on a scale never seen. But some countries are already preparing for students to return to classrooms soon. Some universities, however, will maintain online classes. The modern world has not seen anything like this before. It will take us some time before we can return to the old normal we knew. For now, grandparents hugging their grandkids is still to be avoided. Social distancing at work, school, and while shopping must remain in place. A sparse population on the streets covered in face masks is about to be the new norm.
We now turn to our first guest, Saira Madad, who is an American pathogen preparedness expert. Saira is the Senior Director of the System-Wide Special Pathogens Program at New York City Health and Hospitals. Madad has also discussed the outbreak and pandemic preparedness on outlets such as CNN, Fox News, Good Morning America, and MSNBC. She's also worked to combat misinformation, educating the public on appropriate safety measures and helping them understand what information is actually reliable. Thank you for joining us, Saira.
Thank you for having me.
Thank you. Can I go to our first question, which is, now, as in the world, different countries are making some relaxation in their lockdown policies. What is your advice to the public?
Well, first, I think there's the issue of just relaxing any social distancing measures if they don't have the infrastructure in place. But that's obviously a completely different, issue of making sure that the government has what they need in terms of infrastructure. But in terms of what the people can do, so whether you're, if you're living in a country and they're starting to relax, some of these measures, it's very important that people understand that the virus has not gone away. It's still out there. And so if people start to relax their own, measures that we talk about in terms of, staying away from those that are sick, cough etiquette, wearing a face mask, keeping that 6 feet of distance between people, if they don't do that, then they're risking getting exposed and then infecting not only themselves, but other people around them.
We know that the WHO has already announced that COVID-19 may never go away. What's your take on this matter?
I think it's very plausible. COVID-19 is one of those respiratory diseases that, similar to a number of seasonal diseases that we see, like, seasonal flu, even though it's it's around all year round, it's more, dominant in the fall and winter months. I think it's one of those things that I think we should be prepared that it will be endemic around the world. And we just need to make sure we're able to operate it in the backdrop and be able to safely and effectively, go about our daily lives in this type of context. At the same time, we also want to make sure there's therapeutics available that can help decrease, just the overall chances of getting infected. And if you do get infected, making sure that there's a therapeutic that actually is effective and works to lessen either your severity in terms of illness onset or however long you're going to be ill for, or particularly cure the entire illness in and of itself.
So if this virus is going to be with us for so many years, what kind of steps can we implement to effectively live alongside this virus?
I think right now we need to first, make sure, as I mentioned, we have therapeutics in the pipeline. Right now, there are a couple of, in the United States, FDA-approved therapeutics like remdesivir. It's not a blockbuster drug. It's by no means a cure for coronavirus disease. And if you look at the clinical significance of it, it is actually pretty minor. So we need to continue to invest in therapeutics and medical countermeasures that can address COVID-19 head on. So both vaccines as well as, pharmaceutical medication. In between these two, we need to rely on what we call non-pharmaceutical interventions, or NPIs. And examples of these NPIs, as I mentioned, are social distancing tactics, like, maintaining a distance between people. I think we need to continue to, operate that. Given COVID-19 is still so new and there's still a very large susceptible population around the world, we just need to make sure that we are still abiding by these public health measures for now.
There's a lot of focus on the development of a vaccine, but what about some kind of a cure for COVID-19 once someone's actually had the condition?
That is something that's, being studied currently. There are over 100 different clinical trials, worldwide, looking for a therapeutic, whether it is something that can lessen the severity of the illness or particularly cure the entire illness in and of itself. So there are a couple of therapeutics that do look promising right now. I wouldn't want to, speak on what those are or how effective they are, because it's still very preliminary data. And I think we don't want to, confuse people to say, well, this looks promising, but then once the actual results come out, it doesn't have a significant, effect on the population or an individual.
And that was Saira Medad, who joined us from New York. So as the scientific community across the world looks into the development of a new vaccine, let's take a further look at the breakthroughs so far.
As scientists around the world race to create a vaccine for the coronavirus, we take a look at what a vaccine actually is. A vaccine trains our body's immune system by harmlessly showing the virus or bacteria to our bodies. Vaccines can be made from the same germs or part of the same germs that cause a disease, but in a much weaker, harmless dose. Our immune systems then learn how to fight the invading germs and, importantly, remember this information for when faced with the real version. Developing a vaccine for COVID-19 has become an international race against the clock, and according to the WHO, more than 70 different teams are currently working on a vaccine. But they take years to make and develop into a final product for mass use. Some have been hopeful and predict we could have a vaccine by the end of this year, but a more realistic estimate is about 12 to 18 months from now, so don't hold your breath. Scientists have captured the genetic code of this new coronavirus, which is a big step to developing a vaccine. But even then, any new vaccine will have to be tested again and again and again in clinical trials to make sure that there are no unintended side effects and to prove that it is actually effective. But that's only one part of the story. Governments now have to start planning how they will eventually start to mass produce such a vaccine for the world's population, and all the logistics involved in distributing it to the 7 billion people around the globe. How much will it cost? Who will pay for it? Who will get it first? All these questions are yet to be answered.
To discuss the vaccination and the long-term effects of coronavirus, we have Dr. Nair Ahmed, who is an assistant professor of microbiology at the University of Pittsburgh at Greensburg in the United States of America. Thank you for joining us. Can I just go to our first question, which is what precautions are necessary if a government decides to end lockdown?
Thank you for having me. So there are guidelines for countries that want to lift their restrictions on the lockdown from the World Health Organization. The first thing is to understand disease, transmission, and how much control we have on it. Testing, isolating, detecting, and even tracing every contact is going to ensure that the disease is under control, or at least the spreading or transmission is under control. Number two, workplaces, schools, nurseries, these places need to be monitored at all times. The risk of actually having a second wave of infection can start from these places. And then, of course, the most important thing would be, and the most vital ingredient would be educating the masses, empowering people to let them know that, what is the new normal like. There are certain quarantine practices we'll still need to continue, for example, wearing masks and social distancing. Thank you.
We know that mutations in viruses are a common phenomena. How many forms of COVID-19 exist and what impact does this have on a vaccine?
So even though there is mounting evidence to suggest that there are several strains that have been identified to date, but there is also conflicting evidence showing if one strain is deadlier than the other. In fact, there's only one type of strain that is causing this, across the globe. And so the focus remains on the development of a very prophylactic, vaccine. And so many companies are now, trying to develop a vaccine. And what they're essentially finding out is that this virus is very slow mutating, which is good news, because that just goes to show that these companies can play catch up, and they can, potentially develop a vaccine that can be very effective. At least for the short term, for 12 months or 18 months, or whatever the time frame they need to develop that vaccine. Thank you.
So how do we know if a vaccine is actually going to work?
Normally, the way that vaccines are developed is that, vaccines go into human trials only after they have been tested for their safety and efficacy in animals. In this case, because of, the nature of the problem that we are facing with the coronavirus spreading so quickly in the population, we obviously have to find more quicker methods of doing it. So what they're doing is, they're conducting research or trials with these vaccines in animals as well as humans at the same time, simultaneously, and they want to look at the effect it will have. And so this may not be the most efficient way of developing a vaccine, but it definitely is the most expedient way that is available to us. Thank you.
Thank you for your time, Dr. Nair. So we talk about going back to work, but unfortunately for many of us, there may be no work to go back to, or the terms and conditions of work may be very different to what they were prior to the pandemic. To discuss this further, we are joined by Osama Saifi, who is a labour and employment attorney in Los Angeles in California. Assalamu alaikum and welcome to the programme. Can I go to our first question, which is, how has COVID-19 created a new normal for employers and employees?
Wa alaikum assalam rahmatullahi wa barakatuhu. Jazakallah for having me on the show. I think we should analyze this question from two perspectives, the short term and the long term. From the short term perspective, yes, companies overnight basically had to find a way to maintain their business while maintaining social distancing, and it's nearly impossible. For industries like transportation, the restaurant industry, and hospitality, they were hit particularly hard because, one, the demand dropped, and two, it was just difficult to maintain a social distance in that type of work environment. But many employees who are fortunate enough to work from home started to do that. And this has created an interesting kind of long-term question, because certain companies like Facebook, Slack, Salesforce, Twitter, they've allowed their employees to work from home throughout the remainder of this year. Perhaps COVID-19 has created a new normal where working from home isn't something that necessarily was so frowned upon or so impossible to do.
How has COVID-19 affected different national economies?
Now, in terms of how COVID-19 has affected different national economies, it can vary greatly between different segments of the world. You have a place like the United States, for example, which of course has a very robust GDP, very robust economy, with an employment rate of about 14 to 15%. And then you compare that to places like the UK, which has an employment rate of about 4%, Germany about 5%. And so there is definitely a disparity, unfortunately, between these developed countries. And a lot of it may have to do with kind of the underlying economic growth that is kind of tied to these countries. America is known as a place where there's more capitalism, where there's, a lot more freedom for employers to kind of do certain activities and do certain things. Of course, it varies very state to state, but because of that, sometimes it can make it a little bit more difficult to provide support for employees that may need it. Whereas in Germany and the UK, they have different infrastructures up in place that allows the government to kind of come into play and to support companies in supporting their employees. And that creates a different disparity in the global economy. But of course, the global economy as a whole is all being hit.
You mentioned a lot about developed countries, but how in particular has COVID-19 affected developing countries?
It goes without saying that COVID-19's impact on first world countries will clearly have its effect on developing nations, which often rely upon the manufacturing and the services that are provided from these first world countries. The World Health Organization has economists who have suggested that an increase from 50 to 60 million additional people in poverty will happen throughout the world because of COVID-19. And some of these countries sometimes rely upon the relief efforts of other nations who are not able to sometimes take care of the effect on their own labor force. So this creates a little bit of a dichotomy. It's sometimes hard to analyze the actual effect of COVID-19 in these countries, mainly because the countries may not be as densely populated as, say, New York City, and they may not have the same testing capabilities as those other countries. So even if COVID-19 is ravaging that area and that workforce, we may not see it just because we don't see it on the statistics and the numbers, or the lack of testing and the lack of resources that they may have.
So what can employers do whose businesses have been shut down and employees who've simply lost their jobs?
Now, the economic impact on employees and employers has been devastating, and this is a time for prayers. But what employers and employees can also do is to look at the resources that are available for their specific countries and their states and their provinces, whatever it might be. There's certain legislation that is coming out to really address the financial burden that is on the employers and the employees. In addition to that, employees can also consider looking for different positions that are considered essential employees and consider applying for those open positions, because there is a demand that COVID-19 has created that otherwise wasn't here before. And what employers need to recognize is that they shouldn't forego some of their obligations that they have as employers just because their employees are now working from home if they're in that circumstance. They have to make sure, for example, that certain hourly employees in certain states and certain areas are given their meal periods, or given their rest periods, are being provided that same time that they normally worked for, and not being worked for as hours and hours when they shouldn't only be working for a certain set number of hours.
Thank you, Osama. So it's becoming increasingly evident that wearing a mask is beneficial both to contain the spread and prevent transmission of the virus. However, many of us can't get hold of masks or PPE. So let's take a closer look at what we can do.
Here's a method to make a face covering with items you can easily find around the home, such as a scarf, bandana, or an old t-shirt. You'll need a rectangle of the material, roughly 1 square foot in size. You can use a marker to measure out the halfway point to help with the folding. From the bottom, fold up to the middle. Fold the top down to the middle, and fold the bottom up again and also from the top. Now you just need rubber bands or hair ties on either side and fold over to secure. There you go, a quick and easy homemade face covering with items you can find at home.
With that, we conclude today's program, and we hope and pray that you and your families are blessed in every way in these last special days of Ramadan. Moreover, may Allah accept our prayers and in particular bless our beloved Hazur with a speedy recovery and a long, healthy life. Ameen. With that, we wish you best wishes. Assalamu alaikum wa rahmatullahi wa barakatuh.